general public, anybody else that's interested, as well as our candidates here. There are 8 candidates for the health department board on the ballot, and 6 of them have stood up. We are very glad to have them here. Thank you all for coming. And Sharon Hunt is going to be kind of starting the ball rolling. Okay, so Sharon, oh yeah, sorry. Oh, that's on my list. Okay, let's move it. Glad you reminded me. So, okay. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay.
Thank you. If this is your first time in this building, it'll probably be your last. Unless you're going to be dealing with the Platte County Sheriff. The whole building is being given to the Platte County Sheriff. Okay. Thank you very much for coming. We decided this a month ago to have this, and of course there was an event in Dearborn, and there's going to be another one at Parkville Living Center on the 28th. But so we're kind of just right in the center. We just wanted to point at it. This is for the Platte County Health Department. It's a 4-year term. There are 3 openings, 1 incumbent, and 2 of the candidates have decided not to come tonight. Their name tags are here, but we will hear from the others. What my plan is to ask just a few questions and keep them short. Our official timer's not here, so I get to be the timer too. Okay. So what we're going to do is that, and then you can hear me? Okay. Okay, I'm sorry. We have microphones. Okay.
So you might have to turn them on.
Okay.
Is this better? Better? Okay. Whoa. Okay. I usually talk really loud. Okay. Tonight we have some of the candidates. 3 of them are not coming. I believe one is not officially running anymore. I don't have confirmation on that, but I heard a lot of reports. So we're going to start off. They're going to introduce themselves, and we'll try to give everybody a first shot on some of the questions. They're going to introduce themselves, and we're going to skip right to and 2 minutes about a piece, because we want to have lots of time for all the questions that I know we're going to get more of. A little bit about yourself, and what do you think the role of public health is in our county? Okay, that's just getting right into what it is. I'm sure a lot of you are here because I was told by somebody today that there's sure been a lot of chatter about this nonpartisan election, and that's very much true. But it also just shows us the point that we all need to be aware, be informed about every election that comes up, partisan or not. And we have city council, for those of you in Kansas City, coming up, which is also nonpartisan, but it could really affect all of us, whether we live in Kansas City or not. Okay? Without further ado, we're going to, you know what? I think we'll let our first person be Paula Willmarth, who actually is suffering some severe back issues and yet came today. Paula, okay, we are going to time everybody, even incumbents.
Thank you, Sharon. I don't normally need a microphone, but if I get too loud, let me know. First of all, thank you all for coming this evening. I appreciate the interest in this very important issue. I am Paula Willmarth. I am the only incumbent running. I was first elected to the Platte County Board of Trustees for the Health Department in 2016 and have served since that time. I currently serve as secretary of that board. I'm a social worker by trade and training, and that was why one of the main reasons I had an interest in serving on this board. I have been a caregiver for several of my family members. I'm the only child in the family and have served as caregiver for most of my family, as a matter of fact. Public health, what is public health? Public health is protecting the health and safety of populations, whether they be large or small. And in Platte County, this is a population that we are concerned with in terms of public health. As I have served on this board, I have been able to witness firsthand the excellent service that the Platte County Health Department provides to this county. I was particularly, fortunately or unfortunately, as it may be, involved heavily with the department with the whole COVID crisis. I can tell you, because I witnessed it firsthand, that the Platte County Health Department handled themselves in an expert and professional way. They sprung into action. They did everything they could do to, she threatened me with it, everything they could do to protect us, to protect the public. We took a lot of criticism for that, a lot of criticism for trying to protect the public. But the health department stood strong and did a fine job. Again, thank you guys for coming. I really appreciate it.
And you'll have a chance. But I guess we'll just take a commercial break here. We're really, really glad to have our local media here. We have a representative from the Western Chronicle, Beth McPherson. We have Jeanette Browning from the Citizen. We have Debbie. Oh, darn it. Okay. Man, I used to work with 4-H, and they never had any problem hearing me. Okay. Okay.
We have Beth McPherson from the Western Chronicle. We have Jeanette Browning from the Platte County Citizen. We have Debbie Topai from the Landmark. And any others that I'm missing? Okay. So we have that. So watch for yourself. You know, maybe, who knows, if they take pictures or get you quoted. Okay. But anyway, we thank you because we do depend on local media to get the word out to us.
Okay. We're going to do a hop around. Same question.
Hi everyone, I'm Marygold, and I've lived in Platte County since I would say about 2002 when my firstborn was about 5 years old. I'm running for the trustee because I started working at the Kansas, Missouri Health Department. My degree is in biology. I worked in the epidemiological side. I interacted with a lot of hospitals and other clinics to collect data for grant writers. After a few years stint with that, I went over and worked with my husband in small family business, and if anyone works in small family businesses, you wear a lot of hats. So I dealt with accounting, order entry. I mean, I paid a lot of bills, I'm aware about expenses. HR, which is another quite challenging feat, really, especially in trying to hire people now, recently. One of the things that brought me to this is that I was intrigued by, I started public health. I would love to go into it again. I've served on several boards. I held office in the Northland Businesswomen's Breakfast Club for all offices. I served on the North Kansas City Business Council. I think the role of public health is to measure the health of the county, of a population, determine, what's urgent and what's not, but definitely address the public's health.
Wow, is she good on timing, huh? Woohoo!
I'm Karen Payne. I live in Weston, been a Platte County resident all my life. I remember going to the little house, or should say big house, on 4th Street to get my shots. And so I remember a lot with the Platte County Health Department. Took my kids there to get their immunizations. I worked there as a nurse from '94 to 2004. I had a health issue, so I had to retire, but all the years that I've been nursing since 1978, which dates me, but all those years that I worked, I found the last 10 years working for public health. Am I going? Okay.
No.
Working for public health was the most satisfying. You know, trying to take care of the county, find out the needs, assess, stay on top of things is a challenge. But we have, and I still believe we still do have, a great team at the health department. So, glad to be here. Thank you for coming and appreciate your vote.
Yeah, you kind of hold it.
Okay.
My name's Dr. Michael Shafe. I'm an emergency physician. I'd like to start out, though, very sincerely. I want to thank Paula Willmarth for all of her work that she's done in this county. I have distributed out some credentials, curriculum vitae, aka resume. I'm not going to focus on that because that's really more of a scorecard of my dedication to service, to academics, and to helping. But I'd like to just tangent for a moment, because that's what I have done, not who I am. I'm a young man who is blessed to have the love of a good woman. I am blessed to have 4 young men, the youngest is 18, who understand the most important thing in life is it's never wrong to do the right thing. That's who I am. The clinics I've opened, the services I've done are all listed out there for you. I currently serve as the medical director for Andrew County Health Department. I was voraciously recruited because of our experiences that we shared in COVID. I have a clinic up in Buchanan County. We work together. It's a non-paying position, and I'm proud to work with them. For the last 6 years, I've served on the board for the developmentally disabled here in Platte County, as I have a special needs young man. It has been the most rewarding experience that I've had, regardless of what you see on the papers I distribute. It made me feel good about what we were doing. When I saw there were 3 seats open in November, I decided to run. My wife is the driver here. She said, honey, you've opened clinics, you understand business, you understand assessing balance sheets, you understand medicine, you've worked with the FBI, you can all read about it. At the end of the day, I've spent 15 years working with the Scouts, now I'm out of Scouts, and I have to fill a void. Regardless of the politics, I
love doing that.
appreciate the opportunity to tell you who I am, and I look forward to answering your questions.
And then, okay, Steve, you're on.
Thank you, sorry.
No,
Thank you.
I'm hoping my mic is right, okay?
You're doing great.
Hi, my name is Steve Hoeger. I am a Platte County resident since 2002, when my family and I moved into Platte City. Shortly after moving in, I decided to run and was elected to 2 terms on the Northland Regional Ambulance District Board. I've been a paramedic since 1990 and worked for NRAD when they first opened in 1995. I believe in contributing my skills and resources in areas where I have some knowledge and experience. And that's my interest in supporting the health department. In 2017, I was appointed as a Board of Aldermen, council member for the city of Platte City, where I've served terms, and I'm currently on the ballot. Will be running unopposed and will serve a 4th elected term as an alderman in Platte City. After being a paramedic for so many years, I've worked in hospitals. I currently work as the corporate director of emergency management and regulatory compliance for a urban hospital in downtown Kansas City area. I'm also the chair of the Mid-America Regional Council Healthcare Coalition, which brings all of our hospitals, public health, ambulance services and emergency management together to help plan for disasters, plan for things like COVID and other things that have affected our community. We went through dealing with Ebola not too long ago. I was quite often the public information officer for the Healthcare Coalition, was on numerous reports and was able to report out the effect on the hospital. And all along, trying to take care of COVID was to really guarantee the hospitals never became overwhelmed to the point where they cannot continue to provide services. And I can tell you we got very close to that just a little over a year ago. So I appreciate the opportunity to run for the board, be a trustee, and support the health department in continuing their ongoing mission. What is public health? They're taking care of things that aren't normally taken care of in other healthcare environments. So it's not something you'll get from the ambulance. It's not something you go to the hospital for. It's those vaccinations. It is dealing with communicable disease and tracking all of that. So I appreciate the opportunity to represent my thoughts and hope that that aligns with yours.
Thank you. Okay, I would be remiss if I didn't introduce somebody in the audience that has served 33 years on the Platte County Health Department board. Kathy, would you please stand up and take a bow? Thank you. Thank you for coming. Yeah, okay. We're going to get to the questions now. There's some interesting ones. I mean, the elephant in the room, let's be honest, is the politicization of this office and the board. And I think we have a couple of questions about that. Oops. Here we go. Okay. Okay. Yes.
How do we ask questions?
Alice has sheets because we're gonna be announcing them from here. So we'll start with these. Alice, did you see there's another one there? Okay. This is, some candidates have both expressed an intent to be data driven and promote. Oh my Lord! Here. I didn't bring my glasses. I'm sorry. It's good writing. It's very excellent handwriting. It's just my eyes, and I didn't wear my glasses.
Some candidates have both expressed an intent to be data-driven and promote emergency preparedness while simultaneously disavowing scientific consensus of the time and wanting to cut spending. Because these priorities are fundamental at odds, which is your priority?
Okay. I guess what we'll try to do is, if somebody wants to start out, and if people want to say anything else, but I guess we're planning on not all 5 of you answering every one of these questions, unless you feel so driven. Okay, does that sound fair? All right. Who wants to go with this?
I'll go.
Yay, Paula.
So let me talk about data-driven. When we were dealing with COVID, we were data-driven in terms of the responses we were making. We were in constant contact with the Center for Disease Control and other medical agencies that were providing services and information to us that allowed us to respond to the needs of the public. Once again, as I said before, we took a lot of criticism for listening to the Center for Disease Control. If you can imagine that, it's the truth. We were criticized a lot for that very reason. But we provided the best service we could and the highest level of service we could, and we had, I believe, extraordinary information reported out at the, I don't want to say the end of COVID. COVID's never going to end, folks, but by the time the worst was over, we had very few deaths in Platte County. We had very good outcomes, if you will. And I believe it was due to our reliance upon good data.
Anybody else?
I'll speak to it, and then I'll introduce myself as the emergency manager. So out of the things, I would say emergency preparedness is obviously one of my passions with that. I will say at the hospital I work at, we activated our incident command center on February 26th. COVID was expanding and starting to be busier conversations on March 12th, so 3 years ago yesterday. We fully activated our incident command center. We were the first hospital in the region that did that. And with that, then a week later, a little over a week later, March 23rd, we had a patient at our hospital that had COVID, a resident of our hospital. We had 17 staff members that over the weekend had tested positive. I came into work Monday morning. I was the safety officer for the hospital at that time. We decided we were going to mandate masks. We were the first hospital in the region that did that. I had a call that morning with all of the other hospitals. I made that announcement, and I took a lot of grief from some of the other hospitals. It's not necessary. Why are you doing that at this point? And my response was, it's obviously community born right now. We have so many people within our own walls that have it. It's needed. By the end of that week, every hospital, actually by Wednesday, every hospital had gone to that. Our hospital was the first hospital that required vaccinations, and we were the first hospital by about 2.5 weeks. Everyone else waited to see what was going to be the feedback, the lashback on us for doing that, and it was not a popular decision. We're one of the last hospitals to still require masking because it's still a federal requirement. So it is following the data, it is following the science behind it, and I'm proud to say that I was involved in all of those decisions for our organization.
When all of this happened, I think the evidence was very limited. I mean, it was happening all over the world, and based on we, as a small company, we followed the guidelines set by the Clay County Health Department, and that's pretty much, you know, just batten down, wear a mask. And who's to say that maybe without those precautions, we would be in a worse situation than we are now. So.
Thank you.
You know what? Let's just save our time and give it an applause after every question, okay? Instead of every person. All right. No offense, but you know, we kind of need to.
You're stealing my thunder.
I'm sorry. Well, you'll have another chance.
Just kidding. Well, you have a document in front of you that has the things I stand for. It doesn't mean these things didn't happen in the past. But as a physician, when I have a patient in front of me, I need to know what the science says is the best treatment for them. Believe it or not, the science changes. I can recall when giving high-dose steroids to spinal cord injury patients was the standard of care, and you would be sued if you didn't do it. But when the raw data finally came out, it was actually causing harm to patients. Were we wrong to give the steroids? You can look back, but I think if we don't look at the data and be willing to look back and say, were the decisions good or bad? We can't learn. In real time, we make the best decisions we can in the best interest of the patient. I think looking at the data is critically important, but what's more important, just like with a patient, you apply the data to their needs. I've had patients where the data says this is the best treatment, and they say, I don't want to do that. Well, we have a duty, a fiduciary responsibility to offer them the next best option. So when we look at the data, we have a responsibility how to apply it. You see, it's an art of medicine. We have to look at the science, but how we apply it is the art. And applying it means we have to use what I think is the greatest gift God has given me for my profession, is my ears. We listen to the patient, we listen to the county, and we need to gather the data, we need to assess the needs of the county/patient, and do the best we can with what we have at that time, and not be afraid to look back and say, what could we have learned?
When I first started working for the health department, I was hired to do the epidemiology job. My first training when I went was involving so many areas, but they told us that there will be a pandemic. We don't know when, but it will happen. In that regard, it's been so many years since 1912. There was no funding. We didn't have the resources that we should have had. Then on top of that, we had a climate that people did not want to listen to the science. It's ever changing. When you have a new virus, we'll have another one again. You can't go by one instance and say, okay, this is how it's going to be. We have to have patience, we have to have leadership, we have to have guidance when it comes to a pandemic. We have to have leaders that people will believe in. And if you don't listen to the science, what do we have? So, and in all due respect, we're talking about a population. We're talking about not one person. We're talking about data on a large population. So, that's where I'm coming from. Listen to the science. Change is inevitable. Thank you.
Okay, thank you. I think what we'll do is, I have a couple of questions that are directed to specific candidates. We'll go with those. The first one that I got here, this is for you, Paula. Okay, oh, look at that smile. All right. Okay. Have you in any way, or feel like you've been in any way hampered by the announcements coming from the government in DC or Jeff City in any way? Hampered?
Hampered now?
But, well, when you, as a board member, you know, the announcements, I assume that's what the question is. Do you want to clarify? COVID, I mean, you know, yeah, the COVID announcements, directives.
No, never hampered.
Okay.
We use the best information we had available to us to make good decisions for the population in this county. I don't believe we ever felt hampered at any turn. Where we were hampered, unfortunately, were by people in the county, citizens in the county.
Okay, and this one is also specifically to Dr. Shafe. Given the expected and continuation of pandemics, global warmings, you know, viruses released, would masking and or mandated vaccines be considered government outreach, in your opinion?
Do you mean government overreach?
I do mean that, but I read outreach. Okay.
Let me address that first. And I'll throw this up to the audience. What vaccination is currently mandated to anyone in the United States?
I believe measles are.
No vaccine is required to attend the schools if they sign a waiver.
Which hampers the people in school, both kids and professional staff. We've seen in New York measles outbreaks, and medical science and epidemiology and public health is definitely against that. So,
I completely agree with you.
So
what?
You know, I noticed in your sample video, which you use the term government outreach. Or excuse me.
Sorry, Mark.
Government overstepping, let's put it that way. Again, we see these viruses coming up. I mean, I think we're in agreement on that. So in this county, and I would agree with the social worker, this county we had people fighting against protective factors that would have kept more people safe. You also, sir, in your sample video talked about
Lost control.
there's certainly a lot of people, some worse than others, that were hurt by COVID. And frankly, those that were hurt most were people of color in those communities. So we don't have that yet in Platte County, but you know, the people that were hurt are the people that survived, the people that died, and we can expect more of this. And I think you would agree on that. So I guess when I see that one sample of your communication talks about government overstepping, that concerns me, sir. That concerns me.
It concerns me as well. And I agree with everything you said. There are times that there is government overreach. Can we all agree on that?
Like with abortion.
I hope not to have to deal with that issue on the health board. And I think there's no role for that on the health board.
How about suicide rates among LGBTQ kids? When we have people wanting to ban services in our Mid-Continent Public Library and books. And here in Platte County, our trustees are pushing that type of stuff. Our library.
Is that a question?
I just wanted to say that, yeah.
Well, may I think this is important, and we're all one community here, so it's important we get dialogue. Suicide for everyone is an important issue. I think it's inappropriate to decrease the importance of suicide of one group of people over any other. And the video, I'm not poking my finger at anyone. I'm saying what I believe. I'm not attacking anyone. You and I agree on more than we think. I think I want to take this opportunity of answering you and the rest of the people. I think you're going to find we all agree on way more and have way more in common. And I'm happy to have coffee with you. I'm happy to have coffee with anyone in here, and I had coffee with some people in this room already.
Okay,
We can figure this out.
We gotta move on.
Well, may I answer the rest of that question?
Okay.
Well,
We can talk afterwards as well.
I didn't want to cut him off because I think these.
Oh, you have to cut Mark off, otherwise he'll just go on. Seriously. Is that right, Mark?
You should see my wife.
Would you repeat the question and I will finish it in 15 to 20 seconds?
Actually, well, you can finish it, or let's give somebody else a chance, because this is a question that relates to just what he said.
I thought it was a question directed at me.
That one was, but you brought up what he brought up. So this question goes, how could the Platte County Health Department better address mental health needs? Which, you know, if we're talking suicide and everything else, I think that's a mental health issue. We're gonna try to share the load. Karen, we're gonna start with you. Sure.
I'm sorry if I couldn't address the full question, but I felt it's more important to address.
And he'll be here
Catch
later.
me afterwards.
There's a community assessment done every few years at the health department to see what the needs are. And recently, there hasn't been one in the last couple of years, but there needs to be. And I think the number one issue, health issue that we need to address is the mental health depression issue, along with the older people that are getting heart disease and having to have stents, like my husband just had one done. Sorry, Steve. But I think, you know, with the heart disease, the diabetes, those things are at the top also. But mental health in this community, it needs more, what am I trying to think of? Needs more places for them to go, more opportunities, more referrals. That is a big, big thing that needs to be done, and it can't be done just by the health department. We have to partner with our entities within the county, hopefully the insurance companies will be more available for people that need this kind of service. So mental health, the suicide rate is just too high, especially among children in this community, and I would like to see more done through the health department.
Which, you know, this is kind of interesting. I guess if anybody is moderating before, they know this, but you just brought up something that we're going to address the other two that haven't had a chance to speak. This is a question that's really good. What are your thoughts on childhood vaccinations, and how should the board be involved in vaccinations? We're not talking health department professionals or nurses. We're talking how should the board be involved? Let's start with Steve.
I think it was pointed out they're not mandatory, and I think that everything should be done to encourage. I fully support it, but I think the making it mandatory gets into a lot of personal rights. I was one of the first to stand in line to get my COVID shot, but I think making it mandatory. But I think being front and center in the public and encouraging that, telling the situations where that doesn't happen and the outcomes of that. But I think there are personal rights, and I think maintaining those personal rights is first and foremost. But I think it's educating, it's making people understand what the consequences are of not doing that. We spoke about New York, and we spoke about, bringing back illnesses that we thought were eradicated. But because people aren't vaccinated, we're starting to see those things coming up again, being more commonplace. So it's unfortunate that there are people, and there are a lot of reasons that people hold those beliefs. Anti-government is one of them, thinking, we're putting a chip in it. That was one of the big concerns with the COVID vaccination. I can tell you, after giving a lot of those shots, to my knowledge, there were no chips in any of the vaccinations I administered. But I think it's really education, and it's helping people understand they're doing it for themselves, for their families, and their community.
Anybody else?
Sure.
Okay.
I just want to add that if you truly feel there's a chip in those vaccinations, then maybe share your cell phone too. You know what's tracking you, it's your cell phone. As for childhood vaccinations, I think as a trustee, I think the best effort is to, encourage maybe putting some money into educating the young mothers out there, all mothers out there. They're the ones that are super protective. They're afraid, some are afraid of the vaccine because they don't know what's inside of it. They don't have the education to know what's inside the vaccine. The best you could do is educate and just say, this is safe. This is to protect your child. This is to protect, because I believe that over the years we have a complacency because the majority of us got vaccinated in the 70s. And so we don't see a lot of polio or measles out there now. So why do we need vaccines? The reality is, if more people start thinking, well, we don't need this vaccine anymore, these diseases will start rearing its ugly head. As a trustee, do we make it mandatory? No, I don't think that's a good idea, because there are some people who are immunocompromised and can't take it.
If I may.
Yes.
One of my sons dates a young lady who just turned 18, whose parents refused to allow her to be vaccinated. She turned 18 and asked me where she can go get them and what she needs. That should never happen. But it is the law. I support vaccinations. I will never forget 1982 when I had to go to a track meet at the University of Arkansas. And if we couldn't prove we had our measles vaccine because they had massive outbreak, we had to get vaccinated. But when I got back to Baylor, my immunology professor said, this is where we're learning that the immune system loses its memory over time. Measles is fatal to too many. There's lots of diseases that are fatal to too many. The health board has a duty to educate the public, encourage the public, and set an example to the public of what is in their best interest. Can we make everybody do it? No. But we can do the best we can to do it in a loving fashion, set an example, because that's what I believe, vaccinations, the benefits to society far outweigh the risks. And are all vaccines safe? No. Do people have adverse events? Yes. But we have to weigh the benefit risks. And I think we have a duty to look at the data and make the best recommendations to our county.
Very good. Anybody else? Okay. Oh, Paula, oh, there you go.
Sorry. Just real briefly, I'd like to just let you know how the Board of Trustees operates. We meet once a month with the Health Department officials. We meet with the Director of the Health Department. We have the clinical manager is there. We have different levels of the team operating in the department. And in those meetings, we discuss all kinds of issues. Sometimes we don't get out of there until 10 o'clock at night. We start at 7. We're still beating it up at 10 o'clock, but we have to go. It's just, we're tired and it's too late and everybody's babbling. But one of the important things that we do during the course of those meetings is listen to the officials in the health department. Those are the professionals who can advise us and give us recommendations about what direction they believe we should follow. Now, we are armed with that information, and we're armed with other information that comes to us through other avenues. But in the end, when we give a directive to the health department director, and we do, it is his responsibility and his staff's responsibility to carry that out. But in many, many instances, I want you to know the health department staff comes to us, comes to the board and says, we want to do this. We think this is a good idea. We believe this is in the best interest of protecting and public. We'd like to do this. Do we have your okay? You know, the board doesn't sit there and make all the decisions from start to finish. And I want people to understand that. It's really, really important. So this is really an important collaborative effort between the Board of Trustees and the great people that work in the health department.
Okay, that's okay. All right. We have, oh shoot. Okay, there's a couple of questions in here, and these are the last two that we have. I mean, I have a couple of others, but these are probably a little bit more germane. Okay, we start out, and this is going to be for everybody. Okay, do you think the health department should have received COVID money at the beginning of the CARES Act? If we're talking here politics, with public health being political now, which it should not be. How are you going to keep politics out of the Board of Health? And reminder, this is nonpartisan. Okay, let's see, who hasn't had a chance to go first? I think Marygold, to you. And then we're gonna go this way.
I look at that question.
You'll get it, you'll get it.
No, I look at it. It's a long one.
Yes, oh yeah, for sure. Well, it's a combination of this one too.
Oh.
I feel that the health department should be eligible to have CARES, to enroll that COVID money. I guess I can't really find the right words, but they are no different than any other company. They are no different from any other business. In fact, I think they're the most high risk going out there. And I'm not really too sure why, how other businesses lost money to the health department. I mean, is it possible they lost money because they didn't fill out the right paperwork? You know, is there some sort of census that shows which companies were rejected because, you know, well, that person's money could, you know, just went to the health department because they fill out the paperwork better than the other company. But the way I see it, I believe the health department is eligible for that money. They are a working entity. They have employees. So that's kind of like where my thoughts lie on that. I mean, I'd be interested to know what businesses did not get any money because the health department took it all.
Yeah, well, and we're gonna, okay, and that's about the right length. Wait a minute, okay, hang on, who has it? Karen, you've kind of been at the end of something, and then you. Okay, and then Paula just spoke, so then you're next to you. Does that sound fair, halfway? Okay.
Okay, it is my understanding that there was money that should have gone to the health department, but it did not. And I can't address that because I was not involved directly. But as far as being, just like I said in the past, or previously, I'm sorry, there was not enough money for preparedness, for emergency preparedness. It had been cut, and health department money had been cut. So how can you address a pandemic if you don't have the extra funds available because you're doing extra work? You're doing things that you don't normally do, and I just feel that what happened was wrong.
So how are you gonna keep, we want this too, how are you personally gonna keep, and this is for everybody, how to keep politics out of it in the future?
Well, I can tell you as a medical professional, you look at the patient, the community first. You don't use politics to take care of people. You don't use politics to argue over money. You take care of your people. And that's where I would be coming from.
When a patient comes in the ER, they don't have a D or an R stamped on their forehead. There is no role for partisanship in the delivery of health care at the patient level or at the county level. Now, there's a tax levy. That tax levy was not cut, in fact, it was increased. But yet there were needs. I'm not going to get into the unfortunate circumstances that occurred in the acquisition of the new building. To me, that's water under the bridge. When the county needs money, you go get it for the county. Unfortunately, above our level, in the nonpartisan races, it does become political. So we have to go advocate. I honestly don't give a darn where that money came from, as long as it was applied to the needs of my neighbors.
Okay. Whoever wants to. I know it gets harder because you've heard some of the same, what you were probably going to say, but that's just part of the deal.
And the question is, how do we as trustees keep politics out of?
Right, as a board member. As a board member.
I believe we should just pay attention to what's going on around us. Kind of hear the opinions of the people who want to make things political. Look for people who's willing to put themselves out there to have the courage, those of us who are pretty much non-political, and make an effort. I say maintain your trustees. If they show favoritism or if you see them being backed up by others, then that's one way to make it non-political.
I know it's kind of one of those esoteric questions, and I know that. Okay, we still have you, Steve, and Paula.
So again, in my role with Healthcare Coalition, I get to work with all 9 counties and 2 cities that have healthcare or have health departments in the metropolitan area. And I watched how each of them got funding out of the act and what they were able to do with that. Health departments have been underfunded, undersupported for many, many years. People don't typically pay attention. Most people wouldn't be sitting in, you know, I think Paula and Kathy could probably count on two hands the number of people that were at board meetings in 3 years prior to COVID. Unless somebody has an interest, they're usually not there at those meetings. But the health department, again, hasn't received the support that they needed for many, many years. And it was really disappointing to see how our county failed to provide funding to support and enhance those capabilities, where most of the other departments, most of the other counties and cities in our jurisdiction did that. So that was very disappointing. How will I prevent politics from entering into it? Remember, this is a 5-member board. That board is who provides guidance and direction and support to the people that the board hires and continues to staff the health department. Making sure that that board is independently elected and maintained is what's vital. It takes 3 people on that board to make a decision and guide the health department. If people have their own agendas and all of that, that can turn things instantly. So making sure that people who are elected to that position have the best interest of the health department and the public in mind is what's going to keep the health department moving in the right direction.
I'd like to just let you know how the whole CARES Act money was involved in Platte County. It's really important you understand this. That was federal money. I'm sure you all know that. That money went to the county commission. The county commission in this county was responsible for making decisions about who got the money and how much. We at the health department had a tremendous new workload placed upon us. We were trying to meet the demands that were required based on getting vaccinations, getting information out, making sure we were coordinating with schools and businesses, and it was a huge undertaking, and we were doing all that at the same time. The health department needed additional resources. The director of the health department at that time, Mary Jo Vernon, was keeping track, diligently keeping track, so we could turn in our request for additional monies to the county commission. We received no money. The health department received no money until the very end of the process, when in fact, at the front end of that process, small businesses were receiving money. A cigar shop received money, which really aggravated me. This public health money, people, a cigar shop. But anyway, my point is, understand that was the county commission in charge of that money. And Steve was right. All the counties around us, Platte County getting their money, other counties getting their money, Jackson County getting their money, we had none. Until it was practically too late. And we had absorbed it, which was not good for the operation of the health department. But let me just say, I know Sharon wants to get the hook out again, but about the keeping politics out, you know, that's really hard, because I don't have any control about people in the public or other places who are politically inclined to take a shot at me or somebody else who's either serving on the health board or running for the health board. For instance, in the county commission meeting 2 weeks ago, and I want you to know this, it's important.
It was in the local papers too, people. Okay.
The presiding commissioner of the Platte County Commission said to everybody listening, I would encourage you to vote against the incumbent running. That's me. and I'm the only incumbent running. Now, that's politics for you. How I could have cut that out, I have no idea. But it's something that is wrong, that should not come from the dais at the county commission.
Well, that's addressed, but I do want to tell you that we could spend a lot of time giving you a whole background of some of that has happened and how Platte County fared with the COVID. But I'm not a shill for the local papers, I'm really not. But, you know, if you read the Citizen, the Landmark, the Western Chronicle, they do share, even if they don't attend the county commission meetings, if we're talking specifically that, it's written up in their papers, you know, because they watch the live stream and stuff. So I mean, it's helpful, but it's also helpful because we get other information from them. But we do have a big round of applause to thank for all of the candidates that are here tonight, very, very much. And I hope you will, you know, if you have questions, well, first of all, we can take one more from the audience. But if I'm okay with that, offering you.
We have a chance to wrap up with
Right, yeah,
closing
wrap up.
statements.
But then also, when you leave, you know, if somebody has a question specifically and don't want to ask in front of everybody, is it okay if they meet you out there? Okay, sure. Is that all right with everybody? Sure. All right. Oh, we got a question from the corner again, I think.
You're gonna lose control again.
Just a continuing discussion, Dr. Shafe. So I went to the Republican website for Platte County, and 2 or 3 people, including yourself, sir, were endorsed by them. There was a comment that let's support, something like, let's support these conservative people. So I tied that to the county administrator, and because I don't care for him or the other trustees. I think they're, well, I'm not even going to get it. So, sir, when you're endorsed by this group, I have a real hard time trusting you. You present as a very decent person, but
tell me what control I have over an unsolicited endorsement, and then I'll answer your question.
I didn't see a comment from you on that site saying, I choose not to be endorsed by you.
Well, and I didn't ask to be put on the cannot endorse list of your party, sir.
But when I look at the Democratic...
Can you tell me why I was put on the cannot endorse party? I haven't said, done anything to support the Republican Party. I was endorsed by them. I didn't solicit it. It wasn't my choice.
I understand, and I appreciate that, but I guess...
You're attacking me personally because of what somebody else did. Do you want me, I'm not going to be negative. I'm not going to say, I rebuke Scott Fricker for endorsing me. Should I do that?
Sir, yes. Yes, you should. Yes, you should. Because those people, it was just brought up.
It's these politics, we need to get off this board. I disagree with you wholeheartedly, but respectfully.
You should have rebuked him. He and the other tentacles are spreading through this county in all sorts of ways. And
thank you very much.
Thank you, yeah, thank you, Mark. I think this conversation, I mean, it's kind of opened up a can of worms here, but I think this conversation, just in the interest of everybody's time, and to try to be as nonpartisan as we could in getting information, that you and Dr. Shafe should continue that outside.
My wife doesn't allow me to do that anymore.
My wife knows.
But actually, Mark, if I may.
Sure.
I know I got a little spirited there.
That's okay, I like that.
What's important? Yes.
Transparency.
We gotta talk this all out because I'm sick and tired of left versus right when it's our neighbors that need this. I would love to cuss and discuss all of this stuff, but this isn't the timing or the forum for it. But I needed to say, I didn't request the endorsement. I decided to run when the director of the Platte County Board of Services for the Development of the Disabled said, Michael, you've been with us 6 years, you've been a huge help. I think you could help the health board. So, if you have criticisms that I didn't rebuke somebody, I apologize to you and to everyone in this county, but I'm not perfect.
Well, who in the heck is, right? And I just wanted to tell you that we did have the two candidates were invited, you know, I mean, for sure, and they were gonna come up until a couple days ago. So we really wanna thank you. I know you've already had a 2 hour, and I knew we weren't gonna go 2 hours tonight, okay? Sure.
You're in the middle of the video.
Okay, oh, and I'm blocking for you guys, dang, okay. So we're gonna probably call it, but if anybody has specific questions, meet them out in the hallway there. There's a lot of space in this building. You can do social or emotional distancing or whatever you want. But we're going to have a wrap up, but let's first give them a round of applause and then one more after the wrap up. Okay. Oh man, this is gonna be start. Yeah, let's just go this way.
Okay.
But it's gonna be short, right?
Okay. You're the boss. I've decided, I had thought about, since I had, not been employed with the health department, I've thought about for several years running for the board. And it wasn't until a year ago that I decided that that was something I was really interested in. It was a time in my life that I had time to devote to it. And it, like I said before, it's a passion of mine. So I would appreciate your vote. I am certainly nonpartisan. I don't belong to any committee. And I think that we have an excellent health department. We have an excellent county. I would like to see the the health department continue to grow and become what the county needs to be, remain a class 1 county. We need good people. We need people that understand what is going on. We don't need someone that is on there for the power. So anyway, my heart belongs to Platte County, and thank you. I appreciate you being here.
How do I get the politics out of this? Do you all really believe I'm naive enough to think that I could come here, be myself in front of you, tell you about myself, and think I would get the endorsement here? No, I'm not that naive. Do I really think anybody in here is going to vote for me? No. But that's the problem. I sit in front of you all today and say, what's wrong with me? What's wrong with my training? I clearly am qualified. I clearly know how to listen. I'll cuss and discuss for the benefit of both learning. But I had no delusions of grandeur that anyone in here would vote for me or tell their neighbor to. But instead, my spirituality said I need to come and just tell you who I am. So this is my try to get the politics out of it. The next step is up to each of you. I've given you the chance.
I want to have a chance to serve this county. I have the opportunity to be part of this growth. Part of the reason why that building was built, to accommodate a growing Platte County. And if you don't know, Platte County is the wealthiest county in the state of Missouri. So with great wealth comes great growth. So I would love to be a part of that. I visited Andrew Worland, the public health director, because when all the news came down a couple months ago, I called him up and I said, hey, what's going on? Can I come by and visit? Can I tour the older buildings? Can I tour the new building? And he was great to talk to. He is someone that I would love to work with in the future. I would love to work with the trustees. I think they're amazing to see this growth happening back in 2017 and on. And I think it would be an honor to be with a bunch of people who understand growth and willing to kind of power through some of the setbacks that they endured, during COVID. So I would hope that you would give me I want your vote. Please give me a chance. I will serve you well.
I appreciate everyone taking the time to come out tonight and to share your questions, trying to find out information on our positions. I appreciate all of the candidates being here tonight and their desire to serve. Dr. Shafe, I know you knew coming in you were going to be odd man out in the room tonight, and I have a lot of respect for showing up and presenting yourself well. I always try and use my experience. I don't get into things, and I said it at the last meeting. If there was an opening on the library board, you probably want to see me sitting there and applying for it. I don't know anything about it. I read books, but libraries aren't my experience. Health is. I've been in it my entire adult career, 30 plus years. I work with public health every day of my life. I want to serve the community. I'm proud to be a Platte Countyan, and I think that my skills will benefit the department and each of you. And I ask for that vote, and I look forward to serving with the board.
I've had the privilege of serving with some wonderful people on the current board of trustees. Two of them are leaving, Kathy Wright, who's in the audience, and Kathy Hill. I would like the opportunity to continue to see the health department and Platte County move forward. We have purchased a new building. We are going to be moving into it soon. It's a great building. It's on a bus line. We have done everything in our power to make sure we can serve the public to the best of our ability. Consolidating our two offices is, we think, a big step forward. So I would very much appreciate your vote. I will continue to serve you and the rest of Platte County to the best of my ability. Thank you very much.
No, we're gonna have a Democratic Women's meeting tonight, but we don't expect any of you to stay for it because you've already given us a whole evening.